Ladies and gentlemen, Valant!
Thank you. Hi, I'm David Lishner, CEO and co-founder of Valant. Valant is an electronic health record for behavioral health care practices. First, a little background on me. I'm actually a UW grad also from the University of Washington School of Medicine. Went to medical school and residency here. I'm a psychiatrist. And started a group practice in 2002 called the Evidence-Based Treatment Centers of Seattle. Have a passion here in Seattle. I have a passion for making high-quality health care available for people with behavioral health care problems. Valant was started in 2005, and the idea was to use technology to accomplish the same things at a larger scale. So healthcare is a big industry. In the United States, it's 15% of the economy, and the healthcare industry in the United States is as large as the next 10 healthcare industries, or next 10 largest countries' healthcare industries. And behavioral healthcare is being appreciated as a big modifier of healthcare outcomes across healthcare. And according to the World Health Organization, the largest cause of global disability. We're pretty far along. To give you a sense of who our customers are, if any of us in the room experienced depression, went to our primary care doctor for help, and then got referred out to a specialist, there's a pretty good chance that they're using our software. And that could be anything from a solo therapist to a 200-provider specialty group practice. We have 2,000 of these practices, over 10,000 users, and it's software as a service. These are small businesses. The thing that separated us is focus on clinical quality and usability. Now, along the way, over the past couple of years, we've had about 30 what we call enterprise customers come our way. These are community mental health centers, very larger organizations that are serving Medicaid populations with severe mental illness or substance use dependence problems. Well, this got us interested in the market because we were focusing on the private practice market, and this market kind of came to us. So as we looked into it, we learned something about this market and looked across the rest of healthcare and recognized that it was experiencing the same problem that's all across healthcare with respect to its technology infrastructure, the electronic health record. The technologies are from the same generation as these technologies. So we saw a chance to do something disruptive, and we bit the bullet and decided to start from scratch and actually build brand new technology, totally reinventing rather than rewriting what the EHR, the electronic health record is. We raised over $20 million, and we're going after that enterprise behavioral healthcare market. And we're pretty far into this process, and we're not going to be the first company that's a software as a service company that's in the small business market moving to the enterprise. But it is daunting. Now, there's a playbook for it, and it's been done many times before, and we're pretty optimistic, and we're bringing the product live in the third quarter. We've already made 20 enterprise sales on our minimum viable product demo. Our mission is to use great technology to exponentially scale the quality of healthcare and to make high-quality healthcare available for everyone. Now, these are the three pillars of our platform. It's really a platform. I'll explain that in a minute. And I shouldn't have to say it's cloud architected, and we're using a dynamic data model, and we're using these technologies. But this is really, these aren't surprising or unfamiliar to people in this room. But in healthcare, especially for the electronic health record, this is radical that we're using these technologies, and that our user experience is mobile app-like. We did have to find a way to hide the complexity, so we built a set of tools that allow us to configure best practice workflows into the system. And this really enabled us to build a business platform where we're building a library of best practice workflows. We have an ecosystem of service providers, academic partners, and software partners that help us configure or integrate best practice workflows into the system to deliver better patient outcomes and attract more service providers, so you get network effects. And that's working very well. The ultimate goal is the triple aim: better population health, a better patient experience at scale, and lower costs. To take on something this ambitious, we had to build a great team. We've got a team now of 30 engineers and product specialists. And culture emerges in an organization over time. And we've appreciated is that our team really values the ability of the freedom to be able to work remotely. Not everyone chooses to work as remotely as he did here, but everyone has that choice. The other thing we value is that we're a culture where we get that mistakes are part of the process, and we think we've made about every single one you can make. But the important thing, as Bruce Lee said, is mistakes are always forgivable if one has the courage to admit them. Finally, we all, or many of us, and if you don't read GeekWire, which I recommend obsessively, unicorn in the startup world is a company with $1 billion valuation. Many of us want to achieve this. I really think it's just a reflection of our wanting to have a big impact as well. This is a great place to be, in our opinion. It's right here where you feel like you have momentum, the wind's at your back, and you're on your way to achieving something great. We're very optimistic and excited about where we are. And there's our headquarters. If you look closely enough on the glass, you can see the reflection. This is in South Lake Union. You can see the reflection of Amazon's headquarters. They're right across the street. There's our lobby. If you want to talk to us, we'll be in the back. Thank you. Questions? Why only mental health? You know, ultimately it goes beyond mental health. I'm a psychiatrist. We started in mental health. When we go into the Medicaid market, care is getting more and more integrated, but the core is behavioral health and Medicaid. We think that's the right place to start to go after an entire market. We ultimately want to be the service delivery infrastructure for all of Medicaid. And once you have that, you can move into other markets. It's a big enough market, though. Well, luckily, so this question is, did I learn how to code? Luckily, no. I had a technology co-founder, so I had enough wisdom to do that. He happened to be my brother, you know, and now he's graduated to individual contributor architect role because we've got a head of engineering and product running the team. So he's happy now as he has less responsibility. He gets to do what he's great at. But right from the beginning, we had a combination of domain and technical expertise, or technology expertise. Yeah, it's a great question. How do you deal with the silos? Well, it's a problem across, and it's really felt acutely in the Medicaid market. You have one of our customers is a community mental health center, but they're standing up a federally qualified health center. So they're going to provide both community mental health and physical health services in the same location. In the beginning, they're going to use another product for a period, and we're going to integrate with that product for the physical health side. They want us, they're a content partner, they're a service provider content partner. They want us to build out those workflows and components to support the physical health use cases, and we will. It'll be along the way between 2017 and 2018 that we do that. And it's a problem across the entire industry. Nobody has a solution that handles the complexity of all the use cases across, especially the Medicaid market. Are there any research publications demonstrating the impact of our work? No, but I think that the thing that's exciting is we're putting ourselves in a position where we actually could do that, because across behavioral health care, one of the big problems is we don't measure outcomes. And we found a way in our legacy product of automating outcome measurement, but measurement is built into the current system. It's a data-first EHR, and the old EHRs aren't really built with the idea of using data for anything but billing. So this EHR from the beginning is built with the idea that data has to be accessible. Every single piece of data is meaningful, and we need to make sure that we have those different use cases in mind, like doing research. I better stop. Thank you.
All right, all right, all right. Thank you so much.